Thanks, everyone. Premier Moe and Premier Horgan will have some brief opening comments, followed by time for a moderated Q&A. I'll call on you to pose your question, and we'll use a one question, one follow-up format, drawing from those in the room and on the phone. Please be mindful that our time is quite limited, but we'll do our best in the time that we do have. Premier Moe?
Yeah, well, thank you very much, everyone, for coming, and I'd just like to extend a very gracious thank you on behalf of Saskatchewan for all the premiers that have joined us here today at the Western Premiers Conference in Regina, Saskatchewan. I have with me my colleague, John Horgan, the Premier of British Columbia, also the chair of our Council of Federation, who has done some tremendously valuable work over the course of what is nearing the last year on leading our Council of Federation, all 13 premiers across the provinces and territories here in a discussion primarily focused on healthcare, but also focused on how we are collectively as premiers leading our nation out of the global pandemic that we have all faced and worked together on over the course of the last couple of years. There's some significant challenges that we are addressing in each of our jurisdictions. One is obviously healthcare, of which has been the topic of our discussion this morning, been the topic of our Council of Federation discussion largely over the course of the last year as well, not only in addressing the pressures that we have from the global pandemic, but also addressing some of the pressures that we collectively have across the nation that are impacting all Canadians in the way of surgical wait times that we have acquired over the course of this pandemic, in the way of our diagnostic wait times, in the way of providing physician, medical health professional, primary health care services to not just people in Saskatchewan or British Columbia, but collectively across the nation. This has culminated in our effort and our ask as a Council of Federation of the federal government to be a fair and a funding partner, a full funding partner in delivering provincially delivered healthcare services across the nation. And so that is part of our discussion today, as is some of the other challenges that we have as we find our way through the global pandemic, as we rebuild our economies, as we look towards the future in ensuring that our respective provinces and territories, as well collectively as our nation, is in the strongest position to really succeed as we look ahead and look beyond a COVID-19 pandemic. But I'll turn it over to my colleague, the Premier of British Columbia, the Chair of the Council of Federation, Premier John Horgan.
Thank you very much, Scott, and thank you, everyone, for being here this morning. It is fitting, I think, that we come here, the first in-person meeting of the Western Premiers and Northern Territories Premiers in over 2 years as a result of the global pandemic, and to be in the birthplace of Medicare to talk about the future of public health care delivery in Canada is absolutely appropriate. And Scott rightly says, over the past year, we've been focused on ensuring that the Canada Health Transfer, which sounds like an administrative accounting procedure to many of you, but in reality, this is about how we deliver services at the provincial level to Canadians from coast to coast to coast. And so over the past year, Premier Moe, Premier Fury from Newfoundland and myself have been trying to do shuttle diplomacy with the federal government to get to a place where we can have a First Minister's meeting on the importance of delivering healthcare services to Canadians. This has been not just for the past year. I have been at the Council of the Federation for 5 years now, and just a few months ahead of Scott as the senior premier in the country. And when I arrived at the table, the #1 issue for premiers was healthcare and the delivery of services that are so critical to the people in our various jurisdictions. And so over the past year, as we came out of the pandemic, we did great work. Scott was the head of the council at that time. The Prime Minister and his team were very responsive throughout the pandemic. We met virtually every week for a year and a half to make sure that we were all on the same page. We were sharing best practices, and it was an example, in my opinion, of a federation that was focused on delivering for people wherever they lived, whatever the linguistic or political or regional concerns were. We were there together, despite our differences, to work on behalf of all Canadians. And it was uniformly, I think, and certainly in recent memory, an example of what Canadians would expect from their elected representatives. And throughout the pandemic, We continue to raise the Canada Health Transfer as a critical part of our ability to meet the expectations of our citizens. The Prime Minister repeatedly said, when we get past the pandemic, will be the best time to have those conversations. Well, we're here today. The pandemic is waning. It's becoming endemic, and it's time now to have that conversation. For the past 6 months, we've been trying to get a path forward to a negotiation about how we can best deliver these mutual concerns. And I'm uniquely situated as someone who has been testing the various components of the public health care system over the past 8 months, from diagnostic through the primary care system to a discovery of a cancer, to surgery, to post-op, to radiation treatment, and then the accompanying therapies thereafter. I know the strain on the faces of healthcare workers in my community, and I know that's duplicated across the country. For 2 years, Canadians looked to our public health care system, nurses, nurse practitioners, care aides, doctors, surgeons, to get through an extraordinary time. And we all know someone who works in the healthcare system. We all know someone who has put themselves on the line, put their personal health at risk to provide care for fellow citizens. And now is the time for us to turn back to the system and say, we're going to rejuvenate it. We're going to bring forward new initiatives on human resource development so we can have more care providers for the challenges of an aging population. Now is the time for a new vision for healthcare in Canada. Now is the time for all of us to come together, despite our differences, and deliver what Canadians expect of us. There's nothing more Canadian than public health care. And it separates us from our American cousins, and it separates us from those who are concerned about accessing the system because of cost. We're now concerned about accessing the system because of the frailty of the providers and the inability to meet the expectations of the public. Now is the time, Prime Minister, now is the time, federal government, to sit down with us and plan and plot out the future of Medicare, which started in this great province. And I would hope today would be the beginning of that commitment from Ottawa to come sit with us. We're meeting as a council in Victoria, July 11th, 10th, 11th, and 12th, as a council of the Federation. Now is the time. We don't need to wait any longer to do what the public expects of us, which is to work together to deliver the services that they depend on.
And we'll go to Jeremy Symes with the Leader Post.
Yes, sure, this question's for both of you, but there's been some criticism that more money isn't necessarily needed, but we need to change how we fund healthcare in the provinces. I just wanted to get your reaction to some of that criticism.
I would just very quickly say that's an easy, nothing short of an easy cop-out. Yes, we do need to continually change how we are delivering health care, but the fact of the matter is, and Premier Horgan had mentioned, the health care that we are offering and delivering in our respective provinces is being delivered in the best interests of the patients, of in our case, Saskatchewan residents, collectively us as premiers across the nation. What we are asking for, and Premier Horgan had said this, it sounds like an accounting exercise, right? We've asked for an increase of $28 billion. We've asked for an increase from 22% federal funding level to 35%, which is the appropriate federal funding level. What that means to Canadians, to people in Saskatchewan, British Columbia, and across this nation is we will be able to ensure that existing services that we have are sustainable into the future. Services like reducing our surgical wait times, of which we have across this nation, regardless of where you live. Services like expanding our diagnostic services to reduce those wait times as well. Expanding and sustaining our primary health care access, our access to medical health professionals, whether that be a nurse practitioner, whether that be a physician. It also then provides us the opportunity to have a fulsome discussion about, areas of healthcare where quite likely in today and in the years ahead, and we already are expanding services, for example, in the area of mental health and ultimately addictions treatment and rehabilitation for those that are struggling with addictions. This is a conversation that most certainly is deservedly in this province of additional funding, and we've seen that in the last couple of years. We saw that this year, and it's going to have to continue to increase into the future. What this accounting exercise of increasing the federal funding share from 22% to 35%, which is the appropriate amount, does is it ensures ensures not only the sustainability of that healthcare access that we have, but allows us as provinces then to have discussions about how we might advance some of the services, most particularly in mental health care and addictions. And I think in fairness, the federal government agrees on the priorities. What we need to do now is sit down and agree on what the funding level is to ensure that these are sustainable into the future. Some of the 5-year funding envelopes that we are seeing, 3- and 5-year funding envelopes, are appreciated by all of the provinces, are appreciated by Saskatchewan. And we had an announcement on long-term care here just the other day. They most certainly are appreciated, but they don't speak to that long-term sustainability that an appropriate level in the Canada Health Transfer can. We don't know whether that funding will be there in year 6, year 7, year 8, and so it really it doesn't provide that same level of sustainability that an increase to the Canada Health Transfer ultimately can. So it is, John is right, it seems like an accounting exercise, but most certainly the corresponding impact on Canadians is very large and very much hits home, I think, for all families living across this nation. John?
Yeah, and I'll pick up on Scott's point, and it's a valid question, and it's an argument that we hear back when we say we have a funding crisis. We say, well, you just reallocate your priorities. Well, the priorities of Canadians are accessing a primary care system. We have shortages of general practitioners because of challenges with funding. Is it just about the money? Yeah, it's about the money because the money translates into services for people. It translates into hip and knee replacements, into improving long-term care capacity. It translates into making sure that diagnostic services are there for people early on so that treatment can be effective in the short term and in the long term. When people push back and say, oh, you just need to reassess your priorities, they haven't been to a hospital lately. They haven't tried to access a general practitioner. As our doctors, we have more in Victoria, in British Columbia and Victoria particularly, we have more 70-year-old doctors with panels of 80-year-old patients than anywhere else in the country. And so the impact on ensuring that young families can get access to a primary care practitioner are extremely challenging. And that's a human resource challenge, not just in British Columbia, but across the country. So we are all looking for more people to deliver the services, and that will cost more money. There's no other way to cut that. You can't say, well, we're just not going to do MRIs for a while so that we can beef up our surgery wait times. You need the MRIs to plan out the surgeries, which means you need to have an integrated system that has a vision going forward that's publicly delivered in the interests of all Canadians. I know the Prime Minister supports that principle, but we're not talking about principles anymore. We're talking about reality hitting the road. You can have esoteric discussions in the House of Commons and the Senate, but where Scott and I and the other premiers live, we need to deliver services for people. That's how the system works. When I hear talk of new programs, I'm excited about that. But I think back to the programs that we're not effectively delivering today and say, how can we possibly add more when we can't deliver what we've got right now? And that's all about funding, and it's about cooperation and collaboration, which is the essence of what Canada is. Our federation works best when we put aside partisanship, we put aside regional differences, and we focus on what all of us want to see as Canadians, wherever we may live. And we've been doing that at the table with the federal government through the pandemic. We need to now accelerate that to deliver on this critically important issue for all Canadians.
Next, we'll go to Adam Hunter with CBC.
For both of you, just what's your confidence level? I know you've been asking this for a couple of years. Do you think there's movement on the federal government side that this is the time, as you say, the time is now? Do you think there's accepting that this could happen in the next year or so?
Well, I'll start with that because I've been at the point on this for the past number of months. We have been engaged with the federal government at senior levels, Minister LeBlanc, the Minister of Intergovernmental Relations, Minister Duclos, the Minister of Health, Minister Freeland at Finance is engaged behind the scenes. There are a range of issues that we're all aware of that Canada and the world are dealing with. We're in the midst of a climate crisis. We have war in Europe, profoundly impacting not just the people in Ukraine, but right around the world. It's having an impact on commodities, impact on the economy. All of those things are pressing and urgent, but so is delivering on healthcare. And I'm confident that we can do many things at one time. The notion that, now is not the time to do X or Y. is an abdication of leadership, in my opinion. We have had positive discussions about getting to a table, but we're not at a table yet. When we meet in Victoria as a Council of the Federation in July, I'm hopeful that we can report back to you that we've made substantial progress with the federal government, but I have not seen it yet. We're in the end of May, heading into June. We need to get on this as quickly as we possibly can.
I would just add to that, I am confident that the federal government is going to come to the table and with all of the 13 premiers across the nation and have this negotiation in good faith and look at to what they can do to, yes, provide the funding so that provinces and territories can actually provide those services to collectively to all Canadians. Am I frustrated, angered at times with the fact that it has taken this long to essentially have a number of meetings about whether or not we can even have a meeting to have these negotiations? Yes, I am frustrated, and sometimes I do feel angered that the federal government hasn't come to that table to have that discussion on what is essentially in the best interests of all of the Canadians that we collectively represent. And it is, yes, it's about funding, but more importantly to Canadians, it is about accessing those healthcare services that they expect to access today, which we are all challenged with providing across the nation. Due to what has been exposed as some of those weaknesses over the course of the last 2 years with the global pandemic that we have faced across Canada and around this world. But to answer your question, yes, I do believe the federal government will get there because it is what Canadians want. They want sustainability in their healthcare services. They want access to those healthcare services, whether it be diagnostics, whether it be a surgery, whether it be just simply access to their primary healthcare practitioner in their community wherever they live. Canadians want that. They want it to be sustainable. They want it to be there when themselves or their family may need those services. And so yes, I believe the federal government has a duty to come to the table and ensure that they are a full and fair funding partner of those services that are being delivered by provinces and territories across the nation.
And I would just add that for the cynics who observe our federal system and say, well, imagine that, premiers standing up demanding more from Ottawa. That's never happened in Canada before. I get that this may sound like a record that's been played before, but never have we been at such a critical point in the delivery of the fundamental social program that makes us who we are. That's our Medicare system that started right here in Saskatchewan. And as Scott says, this is not your regularly scheduled program. This is a critical point. This is at a time when Canadians expect us to step up as leaders, to put aside differences, to make sure we're managing all of the other issues that we're required to manage. But at the core of that, there has to be a sentiment in Ottawa and in provincial capitals across the country where we must come together so that we do not let down those who are waiting for surgery, those that are waiting for treatment, those who are waiting for a long-term care facility for their aging parents. These are critical times. Demographics are not in our favor. The workers' shortage you've heard about in every sector of the economy is critical in healthcare. And in order for us to ensure that we're training enough people, we need to have sustainable funding from Ottawa, which was there at the beginning and is not there today. It's as simple as that. Ottawa needs to get back in the game. They need to be full partners, and we're not even asking for full partners. We're asking for 2/3 partners in the delivery of what is the most important national program that we have.
And we'll take our last question on the line. We've got Richard Zussman from Global.
This is for you, Premier Horgan. You talk about the urgency here. If there is some sort of deal with Ottawa, it will take some time. How quickly could British Columbians and Canadians feel the impacts of this? And unrelated, a more local issue here in British Columbia, the Metro Vancouver mayors are once again putting the idea of mobility pricing on the table as a way to close that transit funding gap. Would the province support mobility pricing, charging people to move around Metro Vancouver as a way to help pay for transit?
Well, I haven't seen the latest comments from the Metro Mayor's Council, Richard. I'll certainly be happy to comment on that when I get back to British Columbia and I take a look at it. Obviously, ensuring that we're expanding our public transit system, which we've been doing very aggressively in British Columbia for a couple of decades now, but most recently, as you know, rapid transit, SkyTrain through Surrey into Langley, out to Arbutus through the Broadway corridor, and then out to UBC. Those are all in the capital plan. We're moving in that direction. We need to ensure that there's stable funding from municipal partners, and we'll continue to work on that. But we have no plans for mobility pricing at this time, but I'm certainly prepared to hear the arguments and sit down with the mayors and figure out where we go from here. In terms of how quickly we can expect to see positive results for patients and citizens as a result of our efforts, collective efforts, to increase federal funding for the delivery of services in British Columbia and across the country. When we have a commitment from Ottawa that they're in the game, we can start planning to build out our system. That's what we need, sustainable long-term funding, or at least a commitment to do that beyond we'll talk to you later, means that we can start planning tomorrow. If we had an agreement today, we could start planning tomorrow, build out those services, ensure that we're creating the spaces for training the next generation of healthcare workers to deliver those services that people need.
On that point of the question, I would just add, there's really two initiatives that I think can come out of this opportunity that the federal government has to participate in these conversations and to become a one-third funding partner of provincially delivered healthcare across the nation. The first is, yes, there's areas where we need to look at enhancing or outbuilding our healthcare services. I mentioned mental health and addictions. There might be some areas of Canada where long-term care is on the list of where they need to outbuild, and that just speaks to a little bit of diversity that we have across this nation. The second piece, I would say, in addition to outbuilding and expanding some of the services that we have, is to ensure the sustainability of the existing services that we have. Year after year, it has been the provinces that have stepped into this space as federal government funding has slipped in this area, in the area of the Canada Health Transfer. Provinces have been doing everything that they can financially to ensure that as people continue to arrive at the door of our healthcare facilities, our long-term care facilities, that we are providing that funding to provide those services. Provide those services that Canadians expect for a number of years now. And so part of this negotiation is, yes, about expanding some of the services that Canadians feel are necessary, and those may differ a little bit across the nation. But the second part of it, and just as important, is ensuring the sustainability of the current healthcare system that we have, and ensuring that we can recoup some of the lost ground, quite frankly, that we've all experienced across Canada over the course of the past 2 years as we faced this global pandemic together. Thank you.
And I would just, sorry, Scott, to get a last word in your town, but this didn't happen yesterday. I don't want people to take away from this that this is all about the current federal government or current provincial governments. This has been building over decades, and it's time to stop that and reverse the trend to get back to a place where Canadians can have confidence that this #1 priority for them is also the #1 priority for their elected representatives.
Thanks, everyone. That's all the time that we have.
Sorry, if you have a moment. I just wanted to ask about Prime Minister Trudeau's visit here the other day to Saskatchewan. Obviously, you and the Prime Minister have a lot of really disagreements on a lot of issues. And, there was a lot of animosity shown in Saskatchewan. I mean, how do you kind of mend the fence and sort of build that relationship with the feds to work on things like health transfers?
Listen, we've had some disagreements with the federal government from time to time, but they've always been issue-based disagreements. We've seen many times where Saskatchewan has worked with the federal government where it is beneficial to the residents of Saskatchewan. We've also seen where the Saskatchewan government has disagreed with the federal government, where we feel that they are acting in areas that are not beneficial to Saskatchewan people and how we essentially, generate our well-being here in this province or the services that ultimately are being provided. We're thankful for the funding the other day with respect to long-term care funding that was being provided to this province, like it has been across Canada. Again, it's short-term funding. It's not long-term sustainable funding like is offered through the Canada Health Transfer. That is ultimately what is going to provide sustainability in healthcare funding into the future, is to sit down and have these negotiations like all 13 premiers have unanimously asked for across this nation, to provide that that sustainable health care funding, not just this year and next year, but for years into the future. That is ultimately what Canadians expect. They expect those services in their community or nearby. This is how the federal government can become a funding partner in that to a level that I think is acceptable among all Canadians and certainly among all premiers. So, thank you.
Thanks.
Thanks, everyone. That concludes our press conference this morning.